during the financial year, July 2022 to June 2023, way before the expose, they had conducted investigation on 27 providers. So the role of the expose,
let's
Chair,
pause there. Let's pause there.
Yes, Chair.
Is any of the 8 facilities among the 27?
It is the 8 facilities are among the 27, Chair. And the 8 facilities were under an investigative process way before the expose. And dates have been presented in our presentation. So, Chair, what the expose did, so that I can get into the details, it brought to the fore what NHIF goes through. You are right, Honorable Chair and honorable members, in saying that indeed there was collusion between NHIF employees and fraudsters for this fraud of this magnitude to happen. And what NHIF did, some of which was in the media, was to take disciplinary action on a number of employees. Some were interdicted. I think I have 3 who were terminated. I didn't carry the record because I didn't anticipate this question, but I can provide record of the various employees and the action taken on about 12 employees who went through a disciplinary process, one disciplinary process or another. So the board is concerned, and the new management, because they actually had to bring on board a new CEO and a new 6 directors 2 months ago. I'll be celebrating my 2nd month anniversary on the 9th, but that's not an excuse.
Are you sure, CEO, that all the 6 directors are new, or some of them were still internal in the system?
Chair.
Anyway, endelea. Let's continue.
So Chair, so regarding that question, the board is taking seriously the questions. Now, you asked, there are so many things that have been referred to the board.
That we are doing something that is not medically necessary. I think that is not true, honorable members, because before we do any surgery, as Dr. Kuhora had pointed out, we send the x-rays to NHIF. Almost all our cases are surgical. So either somebody has a problem with their brain, either somebody has a problem with their heart, or whichever medical condition they have, we'll send that to NHIF. And there's a team of professionals who will go through that. And there are cases when they approve, there are cases which they don't approve. So all cases that we do are through pre-authorization. So just to point out that we were being accused that we transported patients and did influence them to get benefits, which was not medically necessary. I want to state that Kenya Medical Practitioners Board went through a number of our files. They actually took files for 3 months that we were requested to provide files for 3 months, and they went with those files. And in those files, there is X-ray before surgery, and there are X-rays after surgery. There are ultrasound or MRI before surgery and after surgery. If these things were not medically necessary, I think Kenya Medical and Practitioners Board will have flagged it, not NHIF. Then to the last accusation from NHIF is that the dates of admission from our physical files differ from the date of admission on the discharge from the system. I'm lucky to have gotten the annex. Please have a look at the annex. You'll see that some cases, like number 43, is a patient with an intertrochanteric fracture. Honestly, this is a fracture. How do you want me not to treat this patient? because I need to have to
Doctor, that is Annex what you are referring to?
Annex B, 7B. I wish. I wish.
You are referring to number?
Look at number, for example, number 11. That is a diffuse disc bulge with severe spinal canal stenosis. That's an emergency, guys. Oh, sorry, honorable members. If we don't treat this patient, in the next few hours, this patient will be paralyzed. So you accuse a hospital because we've done a surgery before approval. There are cases here which are, unfortunately, and sorry, I hope the UHC will have doctors in their panel. We don't have any doctor in NHIF. The best we have is a pharmacist, who is Dr. Kuhora, who doesn't know what is emergency and what is not emergency.
Dr.
The rest,
Dr. Wesena.
Sorry, guys. Oh, sorry, I get emotional
no,
when.
Let's agree. Yes, you get emotional, but let us not get emotional. That is why you are before this committee. This committee is not NHIF. It's not Minister of Health. Our work is to listen to everybody. Just
I've looked at this, what I'm being accused of. I'm being accused of two things. St. Peter's is being accused of two things. One is that there are patients who were brought from somewhere else, brought to the hospital, operated. There's no one who has accused St. Peter's that we did not do surgery. We did those surgeries. And in our submission, the surgeries were necessary. No patient has come to the institution and said, hey, I was not blind, but I was operated on my eye. Those patients will tell you, I was blind, cataract was done, was excised out, and I'm not now able to see. I think that is the role of a medical institution. Lastly, I'm being accused of the second thing, that...
Dr. You know you are making very good progress, especially pointing out, like what you have done, that if you look at this patient, they are this, and you know now you have, at least you have information before you, so that we make progress. Yeah. We understand that you have made your submission. I think just continue making progress in that direction so that we're able to conclude. Okay. We have understood your accusation.
My last submission, like honorable member, is that the second, that we need to refund 14 million because we did surgeries, that the dates of admission and discharge differs from the records. I think that's being unfair to us because we actually did these surgeries. The surgeries were done. The services were offered. We were probably a medical camp activity. Before the license is issued, there are several items that they require to provide to KMPDC. Number one, we give them a form where they fill who the sponsor of the camp is. Number two, they feel who the medical director of the camp will be. Because Senator, for example, you may be the sponsor of the camp. But in terms of patient care, you will require an in charge, who is either a doctor or a nurse, depending on the level of the camp that you want to, that is going to be undertaken, just as an example. So once they have provided us the lead medical camp director, the third is to provide us with a list of all medical personnel who will be there on that camp during that day or days. Those are doctors, nurses, clinic officers, laboratory, physio, all the services they want to provide. They provide us a list of those persons and their current licenses. Number four, they provide us with where the camp will be held. Will it be in a school, a market, a hospital? And where that happens, they also attach a no objection from the county government where that will be situated, considering that health services happen within counties. So there is also a county no objection
or county participation. After that, they provide us, the next thing they provide us is a list of facilities where they will refer the patients to for those who will require management beyond just attending the medical camp. So maybe somebody with heart disease, you'll tell us we are going to refer to Mbagathi Hospital. Maybe, you know, they give us where they will, and sometimes we even require, you know, like a memorandum of understanding between the camp sponsor and the hospital that patients will be transported or referred by themselves to that facility. The next that we require normally is a report after the camp has been completed. So when we get all that, we actually issue a license so that if they were to be found, they would show that this is, you know, a legal camp that has been done. However, this is now beyond the question. We have noted that some people or facilities are going out in the name of what they are calling outreaches to bypass the requirement to have a license for a medical camp. And we are working with the counties to close that gap so that even those who claim to want to do outreaches do it with approval or in consultation with the county health department.
That to this day, NHIF has no capacity whatsoever to establish something called medical necessity. The NHIF is not, let's just be honest, they are not able. The reason is traditionally the staffing of NHIF has not supported.
I want you to limit yourself to what you have written in your submission so that we are able to move very fast.
It is right there, Honorable Chair. We are proposing the establishment of a medical review board or panel within the National Hospital Fund or its successor. And this should come from the professional bodies like the Surgical Society, the Kenya Orthopedic Association. What you are looking at today, Honorable Chair and members, are questions whether procedures were medically necessary. And we are relying on the NHIF audit department to tell us whether they were necessary. Our view as an association is that, with due respect to the audit department, so the audit department is not able to answer that question. They can only flag based on the money they have paid. Number two, Honorable Chair, a lot of this issue came from the branches, and I mentioned that on point number B. So the allegations of fraud that the committee is invested in our view, are a tip of the iceberg. And why are we saying this? We believe that the NHIF branches are the weakest link when it comes to managing medical fraud. And in our own experience, we have established that one, between NHIF headquarters and the branches, there exist very weak checks and balances. In other words, if we were to be honest, it is not possible for the NHIF HQ to establish what actually happens in most of its branches.
We need more time to actually interrogate the submissions that have been made. And arising from the submissions, we have a number of new issues and questions related to the subject of discussion that we shall need to canvass. And because of the time some of these matters have taken, Bwana CEO, and you have indicated here in this committee that there will be a board meeting, I think, on 13th of December. You will appear before this committee after that board meeting, and we would expect that some of the matters would then have been settled so that this committee can then make the most appropriate decision. We definitely have intentions of asking the board to appear before this committee, but so that we make progress. And as a committee, we said we don't want people coming to stay in Parliament because we also believe work must continue. So we are giving you the leeway and discuss with your chairman and your board that they need to make that decisions. First, we have noted the inordinate delay. When you talk of 90 days plus 90 days, and then when we look at the dates in which the matters began, is a year or two, then even if assuming NHIF was correct, that there was fraud and so forth, then you'll have taken time for action to be taken so that the funds can be recovered for public use. And where probably later the determination will be there was no fraud, the damage you'll have caused to those institutions will be repairable. So there was reason as to why the timeline of 90 days was given, and it needs to be adhered to. The other issues that I would like, and we are going to put it in writing, but I just need to tell you so that as you go back to office, you want to think about them. There are a number of things to do with approvals and pre-authorization that needs to be checked. We are going to write to you, of course, to find out those who are doing pre-authorization. And because these are medical claims, and NHIF is like a regulator hospital. The people who do pre-authorization, are they medical staff? Are they in the same cadre as the services? And we shall be asking within your personnel in terms of staffing, how many of your staff are medical trained officers and what cadres, and what are their responsibilities. And we shall be more concerned about the Department of Claims, the issues of pre-authorizations. We have no problem with accountants and procurement and the other guys, but this part that is so critical to the operations of NHIF, we'd also want to understand the issue of staffing. So that if you're having a challenge of staffing in that area, then this committee can help you in terms of policy and push in the ministry to make sure you're adequately staffed in that area. Finally, you have listened to the submissions of the hospitals who are here. Based on the submission, and I'm going to ask the clerk to give you a copy of the submission, I'm particularly concerned on the issues of surgeries of St. Peter, and I think a few examples were cited there, where a patient, if that surgery would not be done, then would go towards fatal.